So probability of all four getting disease and any one getting disease. So all four getting disease, then what you have to do is multiply. Any one, then add each probability. Asha visit after delivery, so that is 765. Normal delivery 7. If it is institutional, then 6 and 5. 6 for institutional normal delivery, cesarean, then 5. So it begins like a 1, 3, 7. Multiples of 7. 7 into 2, 14. Then 3, 21. 4, 28. 5, 35 is not there. Instead of that, 6 into 7, 42. How many diseases are notified in Factory Act 29? Food and Agriculture Organization, food. So it is about nutrition. Fishery, farming, forestry. Menstrual hygiene scheme, you have to remember that sanitary pad is free day and total number is 6. Each one will have 1 rupees, total 6 rupees for 1 pack. Then hormone replacement therapy, you have to stop 4 weeks before surgery. Complications of extubation, there will be negative pressure pulmonary edema. Respiratory distress like bronchospasm can be there, and also hypertension, tachycardia. Then next, more lipid solubility, potency will increase, like sofentanil is most potent and also more lipid soluble. Then next, local anesthetic systemic toxicity, CNS is very sensitive, that there will be perioral numbness, then you have to remember it is CNS features. Rhabdomyolysis, bradycardia, all that will be in halothane. It is an inhalational. Same like that you can also get in propofol infusion syndrome. Halothane hepatitis, autoimmune hepatitis, there is central lobular necrosis. Balanced ventilation is equal to two things. One is exhaust and centrifuge ventilation. Exhaust, we are keeping outside exhaust. Centrifugal fan you are keeping inside. That is total balanced ventilation. HPV vaccination you are given, but later when you check that titer is low and that patient got a needle prick. Now what to do is he have to take HBIG, immunoglobulin 2 dose. Next, population covered by subcenter is 3,000 to 5,000 in hilly area. Hilly area, remember it is hilly area, the population is very low. So the coverage is low, 3,000. Then next, treatment of falciparum malaria is quinine and ACT. So quinine first trimester, ACT rest of the trimester. Don't write chloroquine, even pregnancy or something. Chloroquine is for Vivax and Ovail. TB center hierarchy, central, state, district, and last one is designated microscopic center. IRL is state. IRL, behavioral science versus quantitative method. So whatever we usually say, like cost benefit, cost effective, work sampling, model, decision making, then network analysis, all that quantitative method. If you are given something other than that, that is behavioral science. CAT-G gene is isoniazid resistance. Zumab is actually humanized, but not 100%, only 95%. Acute gout, you are getting, your management is colchicine, but in CKD steroid. Luminal amebicide is PD, paromomycin diloxanate furoate. Abacavir side effect is hypersensitivity syndrome. Overactive bladder, the treatment is soft sulfenacin, oxybutynin, flavoxate and tolterodine, of which you have to remember sulfenacin. M3 selective is sulfenazine, darifenazine, oxybutynin, flavoxate and tolterodine, of which direct smooth muscle relaxant, that is oxybutynin, flavoxate. Tolterodine is bladder selective. Oxidative deamination of glutamate. Glutamate dehydrogenase. There is conversion of glutamate to alpha ketoglutarate acid. Which amino acid is not formed by post-translational modification? Answer is selenocysteine. It is co-translational modification. Cephalin is present in, cardiolipin in mitochondria. Cephalin is in phosphatidyl ethanolamine. Worsening of porphyria by barbiturate is because of inhibition of which enzyme? ALA synthase. Lead is inhibiting ALA dehydratase and ferrochelatase. Folate trap is due to deficiency of vitamin B12. Dash is required for Purine ring, not pyrimidine. Glycine. Serine for converting into glycine need B6 and B9, folic acid. Taurine synthesized from which amino acid? Cysteine. To assess taurine. To assess OP toxicity, organophosphate, most accurate is RBC cholinesterase, but most easily you can do is plasma cholinesterase. Best modality to identify cocaine packet is CT. Vicarious liability is not a defense, because it is not a defense. You cannot make it as a defense, right? They are punishable, and not only that person, his master is also punishable, so it's not defense. Extra burden. Get less as you are looking for chloride. Inverted crucifixion is positional asphyxia. Maximum risk of infection in which IV agent? Propofol. It can get contaminated. Second gas effect and diffusion hypoxia. Both are related to nitrous oxide, but one is during induction. Second gas effect, diffusion hypoxia, is during recovery. So induction with along with the inhalational agents. EMLA cream, the composition is how much? Both are equal, 2.5. Lido and Prilo. Which anesthesia ideal to perform in inguinal hernia as fast track is infiltrative anesthesia. Anesthesia in PIH is spinal, preeclampsia, epidural. Pulseless electric activity gives CPR and epinephrine. Mechanism of action of lidocaine: inactivated voltage gate, resting voltage gated sodium channel, resting. While resting you are giving, right? Then IV agent causing seizure is ketamine, anti-epileptic thiopentone. How much percentage BP vacant? 0.5% BP vacant for spinal anesthesia. Growth hormone, which is mediated by insulin growth factor, is anti-lipolysis. Mechanism of action of leukocidin is it is inhibiting organification. Drunkard gait is related to which region of cerebellum? Flocculonodular lobe. 1-alpha hydroxylase present in PCT of kidney. Serotonin present in high concentration in platelet. Reflex mediated by sympathetic ganglia in intestine is one is gastrocolic, enterogastric. Baroreceptor, directly it is acting on nucleus tractus solitarius. Phantom limb is based on cortical plasticity. Prostaglandin is secreted by which portion in male? Seminal vesicle. Chrysops fly, chrysops crying, that is loa loa. Simulium, that is onchocerciasis. In chrysops also you get swelling, that is calabar. In simulium fly you are getting swelling, onchocercoma, that is black fly, blindness. Other one is causing, you can see the worm in the eye. Idiotype versus isotype. Idiotype is the variability in the variable region. Isotype is in the constant region. Smallest unit of antigenicity epitope. Female parasite is burrowing in scabies. So stay tuned. Till then, bye.